Thank you very much for the nice introduction, and thank you very much for the invitation. Very appreciated. So I'm at Bovitech. We have two labs, one in Madison, the other one in Canada, in Quebec, in St. Hyacinthe, and I am based in Canada. So I'm in charge of donor management and recipient management, among other things. So basically, for the last 4 years, I've been collecting, I've been doing OPU, so about 30 collections a week, transferring embryos. But what I like the most is looking at all these aspects of donor management and trying to figure what we can improve to better prepare our oocytes for IVF. So I've been involved in several research projects with that, so some are internal with our research and development team, and a lot of them are with through collaboration with universities. So just to show you what has been happening in the industry, and I think this data reflects quite a lot. So here you can see on the y-axis the proportion of young donors. So young, I took a broader definition than Dr. Bradley, but so below 12 months of age, in 2011, we in our lab, we did collect, so about 10%, I don't know if I can use that. Anyway, 10% of the OPU, so we're done on donors below 12 months of age. So it increased a little bit in 2012 and 2013, but also in our lab, what happened at the same time is we started doing more and more OPUs on farms. So it kind of counterbalanced, even if internally we did collect more young donors, it doesn't show really up here until 2015. So we can see that doubles, and since January this year, so 40% of the oocytes come from donors below 12 months of age. So my point is that it's quite new, and that's a completely different story from IVF in mature donors, and there are a lot of things that need to be researched and that we still don't know. So basically, when we collect young donors, this is a perfect combination of stress for them, because they are young, they are babies still, just the behavioral aspects of all the procedures, so handling the donors, bringing them to the collection chute, all that creates some stress already. Then, on top of that, at 7-8 months, their immune system is still naive. I wouldn't say incompetent, but they haven't seen a lot of pathogens so far. I mean, that just adds on top of the stress. Also, the reproductive manipulation, and I include in that the ovarian stimulation, tends to create some stress as well. There have been, in the literature, some papers about that, but what we see is that with these donors, when there are some subclinical problems that are missed and that we initiate so stimulation and collection, this subclinical disease become clinical, and that affects very badly the results and the health of these young heifers. Well, of course, when we're talking about IVF in young donors, these animals are growing, and at that time of life, reproduction receives a very low priority over the other functions. So it has been known for a long time that puberty is related to body development. And yes, there is a great deal of variation for donors of the same age with different body conditions. So obviously, a donor with growth retardation will not perform well in IVF. But on the other hand, a heifer that has been growing excessively fast also can perform poorly with IVF. So in our experience and our observation, controlled growth and controlled nutritional programs are key elements for success of IVF in young heifers. So basically, we have this young animal that are growing. We are asking them at the same time to produce quality oocytes so we can make some embryo, but more importantly, some pregnancy of that. And that's kind of the picture that we have with these young animals. And that's quite something to manage. So with nutrition, the problem is when you look in the literature, there is very, very few papers associating the growth of young heifers with their ability to reproduce at a young age. So in other words, research has been done a little bit more for the last 5-10 years about how to grow efficiently replacement heifers. But when we're talking about IVF in young heifers, it's a completely different game. And just to illustrate that here, so there are 3 lines, okay? And my comparison that with nutrition right now where we are at is it's based mostly on visual observation by breeders and personal interpretation, and it has a lot to do with their feelings as well. So let's try to find the middle of these lines, and the comparison would be, well, let's say the middle of this line would be the perfect age or a condition for a heifer to start OPU. So who thinks in this room that the middle is the middle is correct on the first line? Can you stand your hand? Nobody? Okay, the second line. Okay. The third line. Okay. So yeah, this is basically the third line. But just to show you that I think the point where we are at right now in the industry is accumulating data about growth and nutrition in order to be able to determine these optimal time periods to start IVF with some decent chances of success. So the technique itself, there are a lot of challenges because they are very small, and some of them can be very small, and that can be the challenge. So restraint, first of all. So they're, like I said before, they are babies. So if you restrain them too much, most of them will just lie down. If you don't restrain them, they will start moving all the way. And we are aspirating about 5 to 10 millimeter follicles. So even some small moves, you're out of the follicle. Your needle might tear some intestine that are there. So that can be very challenging, and restraint should not be underestimated. Height of the donors as well. When you do quite a lot in a day, they are very small, and seriously, at the end of the day, you have to watch your back and your knees because you're almost kneeling all day. So that can be very challenging to palpation because they are so small and young. The rectal tears must always be kept in mind because you want to avoid that, and tissues are very fragile in these animals. So you have to be very careful when you palpate these animals. Then, for the collection itself, for the ovarian manipulations, because you don't have much room, it becomes quite complicated as well because you cannot always orientate the ovary the way you would like or you would do in mature donors, and that can be limiting sometimes to recover enough oocytes from these animals. And finally, the equipment. I remember 4 years ago in Winnipeg, I was looking for a smaller probe to do heifers. There were none available at that time, and right now in the booth you can see at least 4 of them. So some progress has been made, but it makes a big difference to have a small probe when you do collect young heifers, so you have much more room actually to manipulate your ovary, and you can do a much better job, less traumatic for the heifer as well. So technically, there are quite a few challenges. The results right now, and in your proceeding, you've got a paper that was just published. So a project we did with Laval University in Quebec and Marc-André Sira's team. So basically, it's a retrospective study. We look at the IVF records of the 1,031 IVF cycles, and I won't repeat the results. You can read the article if you're interested, but the main points of the conclusion are what we observe in our donor population, and that can be different from others. Donors below 9 months old of age had significantly more follicles. Also, until 11 or 12 months of age, we observe lower development rates in terms of embryo rates. Also, the quality of the embryo produced is generally lower in heifers, even if it was not statistically different. Then there are individual variations, and our primary belief was that there were even more variations in young heifers, but it turned out that individual variations do exist in all ages regarding embryo rates. Finally, we do not observe a significant difference in the number of embryo produced between young heifers and older heifers. The reason being, so the younger heifers tend to have a lower development rates, but because in our observations have more follicles, it compensates for the lower development rates. So we do not observe differences in the total number of embryo produced. Also, like Dr. Bailey explained before, so we're talking about IVF in young heifer, and the goal is genomic selection. So yes, a lot of young sires are used, and it has a lot of effects on the results. I mean, when you're working with the semen in the lab as well, I would say, well, right now, I would say a popular young genomic bull will be used. The most popular one will be used for about 2 months, but the more regular bulls can be used, only for 2-4 weeks, and so the turnover of bulls and so of new batches of semen is extremely high, which doesn't help us very much in the lab making embryos. So because usually the semen from young bulls does not perform as well in IVF and as for older bulls. So yes, it does negatively affect the embryo rates in these young heifers, and it also decreases the quality of the embryo produced. So we tend to have embryos of lower quality as well, and that might be, I mean, SIRE effect might be one of the factors. When we look at the pregnancies of these embryos, and here I wanted first to compare apples to apples. So on this slide, these are only the frozen embryos, so over 1,300. And so what we see, so at day 30, so we for the below 8 months old group, we are slightly below 60% at day 30, and then in the 11 months old group, so 11 months and older, we are slightly over 60%. So at day 60, so slightly over 50% for the group below 8 months old, over 50% for the group older than 11 months old. So we do not see any statistical difference in this set of data. Now, if we are looking at the fresh embryos, so we looked at 11,000 embryos, and so for these batches of embryos, no embryos was frozen. So in these fresh embryos, so freezable and non-freezable embryos were transferred, and we saw a difference in this data set. So between the young heifers and the older heifers, finally at day 60, I'm sorry, the colors are inverted, the colors on this graph, but basically at day 60, we're talking about overall pregnancy rates for the very young heifers around 35% compared to 45% for the older group. Then, do we have a lot of complications with these young heifers? Surprisingly, adhesion rate is not higher in young heifers compared with older heifers. So we're looking at about 1.5 case out of 1,000 collection, and it's not more common in young heifers. However, once they have been stimulated, it's not so so 3.3% of the cases, the week after, when you look at their ovaries, we do see cysts or multiple CLs after the stimulation, so which can affect the next stimulation. And then, because we stimulate them, and so we do use CEDARs for progesterone support, we do see quite a lot of vaginal discharge and irritation of the vaginal mucosa, so vaginitis induced by the CEDARs. Long-term effect, because we are often asked by breeders, so if they start early their collection on their heifers, will that affect their chances to get the heifer pregnant? Some of these donors are kept at our facilities, so, and are bred there. And on average, to get them pregnant, we need 1.3 services, which is not much different from what we see in heifers that are not collected for IVF. Also, when the collections are repeated multiple times, we do not see any effect on the number of embryo produced per cycle. And finally, from time to time, there are some breeders wondering if the fertility of the offspring so originating from an IVF dam would be affected, and we don't have we haven't been doing much work, but now a lot of donors we are collecting actually originate from IVF embryos, and so far their IVF results are very similar to the previous generation, so we do not see any effect. So at the conclusion, it's a very challenging procedure in heifers. It can be quite risky if you do not control the aspects we talked about, and it's a completely different world from IVF in adult donors. So unless you are fully prepared, I really recommend do not go for it. Thank you for your attention.